everyone, and welcome to this edition of The Doctor's In with Dr. Bill Lyle. Hello, Bill. How are you, sir?
Ron, I'm doing very well. It's great to be back together with you.
Yes, great. Indeed. It's always good to talk to you. And I'm Ron Warren, of course, President and CEO of CareNet. So, this episode, we're going to talk about a topic that is absolutely in the news quite a bit as it relates to the abortion issue, and specifically this interaction between abortion and ectopic pregnancies, miscarriages, and sort of how that stuff is sort of framed in the public square. And Bill's going to be able to kind of bring some light to some of the misnomers and misinformation that's out there, particularly from the pro-choice side, to really actually try to scare some people in terms of having abortion laws that restrict abortion, that would have some kind of impact on the health care that a pregnant woman can receive when there are issues. So to kind of get us started, Dr. Bill, let's talk a little bit about like the difference between an abortion and a D&C that happens when there's a miscarriage. And maybe explain what a D&C actually is for those who don't understand that.
Sure. D&C, it stands for dilatation and curettage. It is the surgical procedure that is performed to remove the baby, the fluid, and the placenta after a baby has, for whatever reason, passed away on the inside of the uterus. The huge number one difference between a D&C for a miscarriage and an abortion is, was there a heartbeat before either procedure was performed? With a D&C, where somebody has had an incomplete miscarriage, there is no heartbeat on the baby. The baby, unfortunately, is not alive. As opposed to an abortion, the baby still has a heartbeat. The baby's blood is still circulating from the baby's heart to the umbilical cord to the placenta and back. Big difference is the baby alive or is the baby dead?
Interesting. And there's a real big issue here in terms of intent, right? I mean, what the purpose of a D&C and the purpose of an abortion, there's a big difference between those two things in terms of the intent of what a doctor is trying to do in those situations, correct?
Absolutely. I mean, the procedure and the instruments are the same. But is the baby alive or is the baby dead? I mean, we always see this as we have two patients. We have the mom, who is patient number one, and we have the baby, which is patient number two. And we don't just diagnose with ultrasound. We are now diagnosing and we are actually treating and we are curing babies in the womb. But when the baby has passed away, we can't bring the baby back to life. So we give the mom options. Option number one, we can see what her body does. 1/4 of all pregnancies will end in a miscarriage. And
Wow.
most of the time, the moms can pass that pregnancy on their own. Sometimes they don't. We can use a medication called Cytotec to cause them to have contractions, to push and deliver the baby, the fluid, and the placenta. But sometimes moms don't want to go through that emotional trauma of the bleeding and the cramping and the pain. So a lot of times they want to have a surgical procedure where they can go to sleep, we can deliver all the products of the pregnancy, and then the process is over. But the big difference is the mechanics are still the same. But did the baby have a heartbeat before the procedure was done, or had the baby already lost its heartbeat? So when a woman has been diagnosed with a miscarriage and she's had a D&C, and then somebody says, well, you had an abortion. No, you did not have an abortion. For whatever reason, your baby had already passed away and the baby had died. We were now at the process of protecting the health and the life of the mother by doing that procedure. But did the baby have a heartbeat when the D&C was performed after the miscarriage? No. Does a baby have a heartbeat when an abortion is performed? Yes. And that is the clinical difference between the two.
Yeah, that's just fantastic. And you were sharing with me just a great illustration about the puppy and the guy with the puppy, which I think would be great for our viewers to hear, because I think it's a great way for them to even use this perspective to talk to other folks who may not be medical folks, to really help them see sort of the morality difference between what's happening
Sure.
with a D&C and what's happening with an ectopic pregnancy and abortion, these different things. I think that illustration is a fantastic way to do that.
Yeah, we do a lot of talking and lectures on college campuses. I love speaking with students for life, to give them tools. They know what's right, they know what's wrong, but sometimes they just don't have the tools at their disposal to engage in a conversation. And we don't want the pro-life, pro-abortion conversation to degrade to whoever is the loudest, whoever is the most intimidating, who is the most threatening wins the conversation. That's why we developed a curriculum, just to equip these kids with new tools. But a common question that we'll get on college campuses is, well, there's no difference between a miscarriage D&C and an abortion. And it's like, no, there is a difference. And so I'll usually ask the students, I said, I'm going to tell you a brief story. Tell me, is this morally good or morally evil? If a man is driving in his car and he pulls off the side of the road at a farm and he gets a shovel out of his car and he digs a deep hole, and then he goes over to the trunk of his car and he reaches in and he pulls out a puppy. And then he walks over to that hole, he puts the puppy in the bottom of the hole, and then he covers that puppy with dirt. Is that morally good or morally evil? And almost immediately the students will come back, well, it depends. Was the puppy alive or was the puppy dead? I said, exactly, the same thing. If a puppy has sadly passed away and he's trying to respect the life of that puppy by burying that puppy, there's no problem with the morality of his action. But if he has taken a puppy that has got a heartbeat and is writhing around there in the trunk and doesn't know what's going on, is it morally evil for him to take that living puppy, put that puppy at the bottom of the hole, and then cover that puppy up with dirt? Yeah, that's morally wrong. It's really the same argument when it comes to a difference between a D&C for a miscarriage and somebody who's having an abortion.
And I just think that's a fantastic illustration that brings out the morality difference between this. Kind of like what I was saying before, like the intent is very, very different in both of those situations. One is actually, just, if you will, like dealing with life that has passed, and the other one is actually trying to take a life, which is a very different dynamic and a very different situation. Obviously has a very different moral framework that we're dealing with, and giving those students that moral clarity with that illustration, I think is just fantastic. Now, as you know, because you've been doing this for quite some time, you've been talking all across the country, a lot of the folks on the pro-choice side are really trying to conflate a lot of these issues together, really to kind of scare folks into believing that restricting abortion is going to create enormous problems for women that are facing challenges within their pregnancies. And one of these issues came up recently in Arizona, where the Attorney General there had actually come out and make some statements about the law there that restricts abortion, because the pro-choice side was trying to say, well, if you're going to restrict abortions, you're going to put women at risk, you're going to limit their access to health care when they need medical treatment. Bill, can you talk a little bit about those situations that you're seeing and that you're responding to, both in Florida and then across the country?
Yeah, well, here in Florida, we protect life at heartbeat. At 6 weeks along, we protect life. But the laws are written very clearly, both in Florida and Arizona and in the other states that are trying to protect life in the womb. If a woman's health, if her life is actually threatened directly by a miscarriage or an ectopic pregnancy, in no way whatsoever will that delay the physician in protecting and defending the life of the mother. There's no delay at the hospital. If the mom's health and life is threatened by this pregnancy in any way and the baby has passed away, or if the baby is ectopic, there's no delay. The needs of the mom will be met without any hindrance at all. And people just need to read the way the laws are written. I even have physicians who will be quoted as saying, well, this heartbeat law is going to prevent me from providing a laparoscopy for an ectopic pregnancy, and this woman's going to get hurt. She might die. No. You're a physician. You are literate. I know you can read. Go read the law. There is no restriction to your actions whatsoever.
Yeah. Well, I think that this is really very problematic. Here at CareNet, we have the pregnancy decision line, where we're getting calls from women who are at risk for abortion, and often these women have their abortion pills, and we're having these conversations with them, trying to help them make a life-affirming decision. And one of the interesting changes that we've started to see over the last couple of months or so is that women are calling in and they're saying, instead of saying, I want to have an abortion, they're saying, I want to start my miscarriage. And it's very interesting in terms of what's happening. Now, I don't think that they're making that language up. I think that that's being kind of communicated to them in terms of how they should start to think about abortion. So why do you think that's happening? And then from a moral standpoint, what do you think is kind of going on in the mind of that woman who's trying to reframe this from an abortion to a miscarriage in terms of how they're talking to us?
Well, if you're just saying you're having a miscarriage, it kind of takes that guilt away from the woman that's undergoing this procedure. I mean, it is traumatic. They are scared. They're looking for help. Unfortunately, if they've already been given the abortion pill, they've been given bad advice and they've been led the wrong way. And so to kind of soften it a little bit, they will come in and say, well, I'm having a miscarriage. And this is a problem in our emergency rooms where women are getting the abortion pill, and a lot of times it's mail order, where they have not had an ultrasound performed. The abortion pill is indicated for up to 10 weeks, but we have lots of women who are getting access to the abortion pill. They might be 12 weeks. They might be 14 weeks. Well, first, the effectiveness of the abortion pill drops from 98% to maybe 50 or 60% when they're that far along, but the complication rate goes up. Because when you have a 12 or 14 week gestational age baby in the womb, and the abortion pill is enough to kill that baby and stop its heartbeat, but then the medicine that is given the second day might not be strong enough to get them to pass that entire pregnancy. So we're having women coming into the emergency rooms, and they've been coached to say, well, I didn't take the abortion pill, just to come in and say, I'm having a miscarriage.
Yeah.
And it's deceptive for the physicians that are dealing with them. And we really don't know how many times that's happening because there is no billing code to differentiate between the two. Hospitals work on electronic medical records. They work on billing codes. Our hospital got hit by a cyber attack a couple of months ago, and it shut us down. We couldn't get anything accomplished. We were back to paper. Well, we get most of our statistics on healthcare and medicine based on billing codes. What was the code that admitted the patient? What was the code that they were diagnosed with? We have codes for when a woman comes into the emergency room and she's having bleeding and there's no heartbeat on the baby. But we don't have a code that says, well, this is a woman who is 12 weeks along, she's having bleeding, and she took the abortion pill 2 weeks ago. So we don't have any good statistics except for when we go and speak with the person one-on-one. But even when we know from an individual patient and situation, and we might write it in the note, there's no way that we can document that for anybody who's looking at overall statistics. But it's real important. These women are having a lot of trauma. They're having a lot of anxiety. And this is a challenge for them. It's a challenge for them physically. A lot of women recognize that they made a bad choice. And when they come into the emergency room, if they come into our emergency room, I've gotten calls from the emergency room doctors that say, I have a patient who took the abortion pill. She didn't realize it, but she was actually pregnant with twins. She's having some bleeding. We just did an ultrasound, and we have a heartbeat on both babies, and she wants to know if there's anything she can do to save the life of her twins in the inside. So I'll go down, get the whole history, confirm that we have 2 ultrasound heartbeats on these babies, and we can actually reverse the effect of the abortion pill by giving them a hormone called progesterone. The abortion pill works as a blocker of the hormone progesterone. And there's a ministry called Abortion Pill Reversal, which has over 500 doctors. We've documented over 5,000 times where we have safely for the moms, safely for the babies, reversed the effect of the abortion pill. And so having the physicians know that you've taken the abortion pill and you're having some bleeding, but they still see a heartbeat. If they don't know that you took the abortion pill, they'll say, well, hey, head on home and follow up with your OB and hopefully you'll still have a heartbeat. Meanwhile, if they had told them that, well, I took the abortion pill 2 days ago and I'm having this bleeding, there's still a heartbeat, then they can say, okay, we're going to do a little bit something extra and we're going to support your pregnancy, which is now threatened from the abortion pill, but we're going to support it by giving you a hormone called progesterone. And that is the exact same hormone that the woman's body creates to support a pregnancy. We just give her a little bit to override the effect of the abortion pill, but the physician would not know to do that if they weren't given the whole story.
Yeah, and it's really sad because, the folks, on the other side of this issue, kind of claim to really support women and want to keep women healthy and all these things, and really kind of talk about like that we're the ones that are advocates for women. But when you look at what's happened with the abortion pill, in particular, as you mentioned there, lifting the requirement for a woman to have an ultrasound, even check to see if she's having an ectopic pregnancy or if she has twins, and the way these abortion pills are now delivered through the mail. I know of someone who ordered the abortion pills. They got 2 pills in a kind of a brown envelope with no instructions.
Yeah.
It was just amazing. I mean, what has happened? It's just sort of the wild, wild west. And then to have the medical profession, if you will, the billing aspect rather of the medical profession, being unwilling to create a code so that we could actually track complications from abortions, so that we can actually help women in that situation. I mean, it's just, from my standpoint, it's just unconscionable. But unfortunately, it's not surprising, because in our culture, abortion is almost like a sacrament, and we want to, in a lot of ways, we want to kind of keep that information from being out there, because we don't really want to have good statistics around complications from the abortion pill. Don't you think that's kind of the case of what's going on here a bit?
Oh, absolutely. And it endangers the lives and health of women.
Yeah.
When it comes to pregnancy, the number one cause of death in the first trimester of pregnancy is still a ruptured ectopic pregnancy, a tubal pregnancy. 1% of all pregnancies are not in the uterus, they're someplace other than the uterus, and that's most commonly in the tube. And if the pregnancy continues to grow in the tube and it ruptures, women can die, and a lot of women do die. When a woman has a positive pregnancy test, it just says there is a pregnancy. It in no way tells you where the pregnancy is. So when you have thousands, hundreds of thousands, and now over the years, millions of women who have taken the abortion pill, statistically, 1% of the time, that pregnancy is not in the uterus, and it is in the tube or someplace other than the uterus. And these women's lives are threatened and endangered. When they receive the abortion pill and they're given it, or whether it shows up mail order, they are told about 3 symptoms to expect. You can expect bleeding, cramping, and pain. And they go, okay, bleeding, cramping, and pain. What are the symptoms of a rupturing ectopic or tubal pregnancy? The exact same: bleeding, cramping, and pain. How's a woman supposed to know the difference between those symptoms from an ectopic pregnancy versus from the abortion pill? So the abortion pill is dangerous for the baby, because 98% of these babies with heartbeats in the womb are going to die. But it's also dangerous for the moms. And we are here to meet the needs of moms and to provide good quality health care to them. And the abortion pill is not meeting that goal.
Bill, one of the ironies of ironies is that we've been told for years is that the issue of abortion should be between a woman and her doctor, right? Yeah. And it's interesting now that we have the abortion pill. Now we're told, no, it shouldn't be an issue between a woman and her doctor. It should be an issue between the woman and whoever sends her the abortion pill. It's such a crazy thing of what we've done, and we're calling this health care, because, as you know, they've reframed abortion as abortion care to kind of give it a framework like it's health care. But this is really not, I mean, aside from the fact that it's killing an innocent human life, but even the way that it's administered, the way that it's managed in a medical construct. I'm married to a doctor. It's not even managed in a way that a medical construct would even dictate in terms of what's happening here. It's really very sad.
Yeah, we've gone from a doctor-patient relationship to a U.S. Postal Service and patient relationship, where they're receiving the abortion pill. I mean, these are prescription medications, and nobody has even evaluated the woman. They haven't gone through her past medical and surgical history. Has she had ectopic pregnancies before in the past, which is a very high indicator of a risk factor for future ectopic pregnancies. And physicians and the governing bodies understand these risks, and they are just saying, well, we're not going to even address them. What is their real focus? They are so focused on getting the abortion now that the risk factors, they are willing to overlook the risk factors as long as they can accomplish the abortion. That's why this is a spiritual battle. This is a spiritual battle that's against the image of God. Yesterday I was watching Bibi Netanyahu address Congress yesterday. And outside of the Congress, you had protesters that were burning the American flag, burning the Israeli flag. Well, why? Because the American flag and the Israeli flag represent the image of the United States and the image of Israel. Well, if they hate the United States and they hate Israel, they want to destroy the images that represent those two countries. That's what abortion is too, because we are created in the image of God, and that's not the day we're born, that is the day of our conception. So abortion at its core foundation is an attack against the image of God out of a hatred for God.
Amen, amen, amen. And that's just a fantastic place for us to end, because we always like to talk about the spiritual component. I'm always reminded, Ephesians, where it talks about our battle not being just against flesh and blood, but against rulers, against authorities, against powers, spiritual forces of evil. And abortion absolutely is a representation of that. So thank you so much again for just fantastic information, enlightening the folks listening here about this very, very complicated issue. And again, for those of you who are listening to this episode of The Doctor's In, I encourage you to listen to it again. I mean, Bill dropped a lot of science, as they say, a lot of great information. You have people that, obviously on the pro-choice side of this that are probably within your friend network and your family. And these Doctors In episodes are just fantastic ones to share with them, to really help them understand not just the spiritual component of this, which is significant, but also the medical and social and all these other aspects that we have to deal with the abortion issue. So until next time, I'm Roland Warren from CareNet with Dr. Bill Lyle. Blessings to you, and may God bless you daily as you serve Him faithfully in all you do.